3 p.m. Eastern time, so we were well into receiving runners, although the real busy part of our role had not yet begun. And I was in a team of 11 for my section of the tent, taking care of just general health needs of runners, which for the most part is dehydration, electrolyte abnormalities. The sodium in particular sometimes gets very low and occasionally high, and then some people get too hot or too cold, so we had ways to treat their hypothermia or hyperthermia. And things were going along just fine, and it was a great atmosphere, really enjoying it, helping people, meeting people from all over the country and a few from outside the country just before the first explosion, which I think was around 3 p.m. And obviously that, in that moment, everything changed. It went from support of the marathon and runners to support of trauma victims, who all of which that I saw were bystanders, were spectators, just near the finish line. I've told people that I would estimate that that I was probably 100 yards from where that explosion was. The explosion was very close to the actual finish line. It looked like within 20 yards or so. It was a loud explosion. You just felt the bass or the reverberation. I couldn't say it's a ground trembling thing, but you could feel the blast, the reverberation from it, and it was loud. And all of us knew that that didn't fit in with the normal marathon experience. Even on Patriots Day, there was no cannon supposed to fire at a certain time. We're trying to be cool and reassure each other, and we have a guy, one of the organizers, on the microphone in the middle of the tent who's close to me, whose job all day was to just orchestrate health needs. But he told everybody to stay where you are and kind of be cool. We kind of started to walk, a few of us, towards the front of the tent to see what we could see. And then, of course, within 10 to 15 seconds, that second explosion happened. And then this is a bad thing. It wouldn't appear to be anything related to the grandstand falling, which was in my mind as maybe which would have been bad in its own right. But it all happened so fast. I think within 1 to 3 minutes, the bad trauma victims were being ushered in. There's a lot of chaos. It became very loud, but people handled it well, and we tried to stay in our section and do as we were being instructed to do. How can we help? I heard somebody in my area comment that this has become a hospital, like a MASH unit, from the television days of MASH, and clearly more of a process that military medical personnel are accustomed to dealing with. There were minutes there where you just had people backed up with grotesque injuries and just trying to stabilize, place tourniquets, start IVs, and then within 10 minutes, I suppose, some of the still significant injuries, but lacerations and soft tissue injuries to mostly the legs, came in and were kind of dispersed to the various sections, including ours. And so we may have had 4 to 6 people pretty quickly that were mainly just big lacerations in thigh and calf area. None that I saw just a lot of dramatic hemorrhage, but people, they were bleeding. But you could just put gauze and wrap them tight and start IVs, talk to them, help them, console and reassure. And if they were close to the blast, they couldn't hear very well. And one lady seemed like she was nearly deaf in the right ear, and just had to yell at her to communicate. I didn't see any of those victims who I would describe as hysterical. I think they were maybe in shock, maybe not physically, but emotionally in shock, and still able to communicate, describe injuries, ask questions. Where's my phone? Is my purse here with me? Certainly I would be telling a story if I didn't say I didn't have just a moment where you think, gosh, I wonder if there's going to be a third explosion.